This is Blujepa. It's the brand name for gepotidacin, and it's an antibiotic. In fact, it is in a brand new class of antibiotics called triazosinethylene. And this medication works very similar to an older class of antibiotics called the fluoroquinolones. So this medication works by blocking bacterial replication, by blocking some of the enzymes in the DNA that help it replicate. So that's DNA gyrase, which is topoisomerase 2, as well as topoisomerase 4. I mentioned Blujepa and fluoroquinolones have similar mechanisms. They both block topoisomerase 2 and 4. However, Blujepa binds at a different site on these enzymes. It binds to a pre-cleavage site. Point being is that it's a more unique site. So in the event of fluoroquinolone-resistant bacterial species, Blujepa is going to make a great alternative. And Blujepa potentially has a safer side effect profile. So fluoroquinolones have great broad-spectrum coverage, but we tend to save them for later-line therapy because of the nasty side effect profile. So there's a black box warning for tendon rupture, black box warning for peripheral neuropathy, potential for C. diff infections, photosensitivity, and we watch out for potential QT prolongation. The risk goes on. And Blujepa also has its risks. We also monitor for QT prolongation, monitor for C. diff infection. Blujepa is also an acetylcholine esterase inhibitor, so we end up getting some cholinergic effects like muscle spasms, potential seizures. So Blujepa isn't much better per se, but as we go on, we're going to see if it's much safer. Blujepa is only approved for uncomplicated urinary tract infections, and it's only indicated for certain bacterial species. Now, when I was looking at some of the data, I saw it had some activity for MRSA, strep pneumo, but no activity for Pseudomonas and no activity for anaerobes. Point being is that it's indicated specifically for bacterial species like staph species, Enterococcus, E. coli, Citrobacter, and Klebsiella. But yeah, this is our new antibiotic, and hope you enjoyed the video.